Hello everyone, today I am here with
Dr. Sherri Lorraine. I'm a doctor of physical therapy and I specialize in women's health, which includes the pelvic floor and breast cancer. And I have my PhD and board certification in CAP physical therapy, pelvic floor.
Today we're going to talk about pelvic floor dysfunction and pelvic floor physical therapy.
Pelvic floor dysfunction is when the muscles of the pelvic floor aren't functioning well. Just like any other part of the body, when a muscle has decreased length or decreased strength, isn't able to relax or contract properly, then the function of the muscle is not going to work. So the function of the pelvic floor is not going to work if you have pelvic floor dysfunction. Pelvic floor physical therapy is just like physical therapy for any other part of the body. If you have a bum shoulder, it's not working really well, you're going to go to physical therapy and we're going to teach you range of motion and flexibility, strength, how to make it work in an everyday setting. Same thing with the pelvic floor. Pelvic floor muscles need to have good range of motion, good flexibility, good strength and control, the ability to relax. Your reflexes need to be working well. So physical therapy helps get those muscles back to working as they should. So pelvic floor physical therapy actually fixes the dysfunction. The dysfunction is the muscles aren't moving well, they're not strong, they're not contracting well, the reflexes aren't working well. So there's a dysfunction in the way the muscles are working, and so pelvic floor physical therapy actually corrects that dysfunction. Right, so when you have any pain in the pelvic region or abdomen, it's going to increase your guarding reflex, and that guarding reflex guards and protects you when you're in pain. Well, then the muscles of the pelvic floor are part of that guarding reflex, and then it becomes a new habit, and the muscle memory is in a contracted position or spasming, and so then again the muscle doesn't have good range of motion, flexibility, and strength, and then it's unable to function correctly. There's a lot of issues post-delivery after having a baby. You can have a lot of laxity, or you can have, again, that guarding reflex because of the trauma. There can be just a simple slip and fall and hurt your tailbone, or a hip injury or low back injury. Any of that can elicit the guarding reflex or debilitate a person to the point where they're not using their pelvic floor as they should, and then the function starts decreasing. Pelvic floor dysfunction is found in everybody, from adolescents to men, women, everybody. The best way to prevent it is to educate people on how their pelvic floor works, and to make them knowledgeable about the muscles and how they work, just like all the other muscles in the body, to have good range of motion, flexibility, and strength, and being aware of those muscles to maintain and work them on a daily basis to where they don't get left behind. They can go onto the American Physical Therapy Association website, and there's a link on that website that says Find a PT. If you go and find a PT, just select Women's Health, put in your zip code, and it'll bring you some Women's Health physical therapists in your area. Yeah, so they kind of go hand in hand. Pelvic floor pain is usually, it's a result of something. Something is causing that pain in the pelvic floor because the muscles are reacting and guarding to the pain. So if we can get the muscles to completely relax and your pain goes away, then it was simply pelvic floor dysfunction, the muscular problem. But if we cannot get your symptoms to go away with the pelvic floor, we relieve them and they go less, but they're not gone away, then that means the pelvic floor is not the primary cause. There's another cause to the pelvic floor pain. Absolutely. Men have pelvic floor too. They function a little bit different than women, but they definitely have pelvic floors as well, and there's a lot of symptoms that go along with that as far as erectile dysfunction. There's a lot of problems that come with urinary incontinence, fecal incontinence, constipation, pelvic pain. A lot of cyclists have pelvic pain related symptoms when they cycle long distances or in a seat that doesn't work well for them. Also when they have any kind of cancer, prostate cancer or testicular cancer related, then all that can cause the same things as women experience with the spasming, the guarding, or the tissue atrophy. So the pelvic floor, its job is to support the bladder from below and from the connective tissue from above. So if the pelvic floor muscles are spasming, they're putting pressure on your bladder. So your bladder is getting a signal from the muscles on the outside saying you potentially have to urinate all the time, or there's an uncomfortable pressure, or you're feeling pain in your bladder. So if we can get those muscles to relax, then it's going to take some pressure off of your bladder and allow your bladder to not have so much pressure or hypersensation. So that is when you have a difficulty having a bowel movement, and that's constipation. So when you have pelvic floor dysfunction that's in a spasmodic state and the muscles are really, really tight, then you're not going to have an easy bowel movement because the muscles aren't relaxed in order for the bowel movement to pass through. And as well as low back pain, there is a correlation there. The inner core is made up of your pelvic floor, your transverse abdominis, your diaphragm, and your multifidus. Your multifidus are muscles that run along the spine. They're intrinsic muscles along the spine. So those 4 sets of muscles work together. So if you have a pelvic floor dysfunction, you're probably going to have some multifidus dysfunction as well, and that will cause low back pain. Absolutely. You have a lot of nerves and ligaments and tendons and other muscles that run in the same area as the pelvic floor. So if you have a pelvic floor that's length tension curve is off, which means it's too long or too short, so that means that it's not functioning in a nice contracted and relaxation position, then it can compromise any of those other parts of the body, and it can radiate down the legs or into the buttocks or up into the back or in the abdomen. So it depends on what kind of pelvic floor dysfunction you have. If you have hypotonia, basically that means the muscles are too relaxed and they're not nice and strong and contracting well, then yes, Kegels would be the way to go to increase the strength and control of those muscles. But if you have hypertonia, which means the muscles are in a contracted spasmodic state, Kegels would not be the direction to go. You would need to get full range of motion and control first. Once you get that, then you can start increasing the strength and range of motion with Kegels. But it's all a process, and it's not something that you should be doing anytime soon if you have a spasmodic pelvic floor. So there's several different ways that you can use hot packs and cold packs, and several different ways you can use them together. So cold is usually something you use when you're in an inflammation stage, which means things have just started to flare up and you need the inflammation to go away, for instance, swelling or redness. And you can use a normal cold pack and just place it on the external genitalia, or you can make little pops if you go to the Dollar Tree and fill up the ice pops with just water, and you can insert them into the vagina. So you can also fill up a glove with water and freeze it and insert into the vagina, but all to tolerance. Heat is a wonderful way to help relax everything and get everything to calm down, like a warm bath or a warm compress on the external genitalia. But another really great way to help increase blood flow and get things to relax is to do hot and cold, hot and cold. So you would do a cold press for maybe 5 to 10 minutes and then a hot, warm compress for 5 to 10 minutes and go back and forth. And again, that's just going to get your tissue moving with a contraction and relaxation of all the tissue itself, not of the muscle, but of the tissue itself, and get things moving. So internal work is just like any other work to the body. So if you came in and your calf was bothering you, we would do a lot of manual therapy, massage, manipulation to the muscle and to the tissue around it to get fluid going and to get the tissue moving well, and any trigger points in that area or any scarring, we would work in that area manually or with our hands to get it working well again. So it's the same thing, but it's just done intravaginally or intrarectally in order to get those tissues moving and to address any scar tissue or any trigger points or just desensitization of the area, helping you learn full range of motion with some stretching. So it's just the same thing, it's just done in a different part of the body. External work, same thing. We do a lot of manual, but externally we also do a lot of exercising to apply to everyday life. So we teach you how to do some relaxation techniques, and we teach you how to do apply if you are Kegels during functional activities like lifting and pushing and pulling and carrying things, getting out of your car. So that's more the stuff that we do out in the gym on the mat. So a hypertonic pelvic floor, when the muscles are in a spasm and they're kind of stuck in this guarded position, we need to get everything to relax. So the exercises that we recommend for a hypertonic pelvic floor is a lot of relaxation and stretching. We do a breathing technique called the big belly blow to help for the pelvic floor muscles to expand and relax on their own, using abnormal breathing patterns. We do a lot of breath work to help relax everything. A hypotonic pelvic floor means that the muscles are a little bit too relaxed and they're not contracting as strong as they should be. Maybe the range of motion is too low and it doesn't go high enough. So we do exercises to help increase that. A Kegel has 3 components: a squeeze, a lift, and a shift. So we start with the squeeze component, and then we work into the lift, and then we work into the shift. All those work together. We have many different exercises that we do with that, but all of them you can do at home. You can do most of them, in a crowd of people, and they wouldn't even know you're doing them. But then we change that into functional activities. So if you like to do abs or lift weights, you can do them at the same time. So the pelvic floor has a lot of jobs. It's responsible for holding up the organs. It's responsible for keeping the urine and the feces in. It's responsible for relaxing when it's time to relax and to evacuate. So it helps out with the sphincters to control the sphincters to keep everything inside as far as urine and feces. So essentially the pelvic floor is on 24 hours a day to some extent. So it's hard to get the pelvic floor to relax all the way, all the time. So it just takes a lot of consistency and work, daily work over and over to kind of retrain the reflexes when they can kick in and do their job, but also have the support of the pelvic floor. So there's a lot of things happening at one time. It also is an internal stabilizer for the rest of the body, for the hips and the back and the abs and the breathing as well. So it has a lot of work to do as far as its jobs in association with the rest of the body. So it's going to take a lot of spreading that relaxation out through all its jobs and making sure that it understands what it's actually supposed to do. So there's a lot of retraining and new habits to learn. 100% control basically means when the therapist gives a patient a command, the patient's able to follow the command 100% of the time. So we use 4 commands here in my clinic, and the commands are squeeze, and cough, and then a gentle push. And we want to see that the patient's able to do all 4 of those commands 100% of the time. That means a full contraction, whatever their ability is, but also a full relaxation. And that means not with a delay, not with a getting stuck along the way, a nice good contraction and a nice full relaxation. Absolutely. Pelvic pain and control do not go hand in hand, but you do get relief the more control you have. So once you get that control, the control is about, again, creating new habits and making the body aware of it doesn't have to be on all the time. Your guarding reflex doesn't have to be hyper reflexive or hypersensitive to things. So the more control you have and the longer control you have, the more you're going to have relief from pain. But also remember that the pain is not always from just the muscles. The pain can be from other things like scar tissue or the organs themselves. So there's other reasons that you could have pain, but it definitely will help. Probably do a little research and see what we do, because we get a lot of people that come in and they're like, we're going to do what? Where? And so I think just really understanding the concept of pelvic floor physical therapy, and that there is a lot of manual work and it is an intimate situation. But again, it's just like any other part of the body. If you came in with your ankle hurting and you didn't want us to touch or see your ankle, it would be hard for us to treat it well. Sometimes it does get worse before it gets better. A lot of girls will have a lot of tenderness or soreness directly after the exam just because they haven't been in that situation before. It's a totally new type of exam than you get in an OB/GYN's office or any other situation. So it's definitely a different concept as far as an experience. So you can get soreness after that. Also, just from normal manual work, if there's a lot of stretching or manual work on soft tissue, then there's a great possibility of getting sore. Another thing is if we're teaching you to relax, there's a good chance that you might experience some leaking because of relaxation of the muscles when you're used to having some tension in the muscles and closing up of the urethra. So sometimes things get a little bit worse before they get better, unfortunately. The biggest thing is if your pain is related to the hypertonicity is just to learn that when that pain comes on, go and do your exercises. That's the whole point of doing your exercises. Also the hot ice in the hot, whatever works best for you, or whatever you find technique-wise, if the warm and the cold together or them separate, whatever works best for you. Anything to get things to stay calm. If you're having pain with up training or the hypotonicity when we're working on a lot of Kegels, it's hopefully it's just soreness and from the muscle building and working, and it's not pain. Yes, we work with Vaginal Valuim a lot. Obviously, that's through the primary physician, the MD. So, or the urogynecologist, or the gynecologist, or the urologist, whoever has sent the patient here. We work with them. We do it a little different in our clinic. We're really close with our physicians, so they let us kind of determine how often the patient needs to use the Vaginal Valuim. We try to do it working with the physicians. We give them a high doses at the beginning for the first couple weeks, and then we tier them down as we're working, just so they can tolerate a lot of manual work at the beginning. But then afterwards, we would like them just to be PRN, so they have the Vaginal Valuim as needed. If they had a really busy day or something stressful happened, they can use it then, but not on a consistent basis. The best way is to have an open mind and realize that it's basic anatomy and physiology. So, you know, there's no other part of physical therapy that you will go to that doesn't work manually on the body part that's injured. So keep that in mind, that it's basic anatomy and physiology. And if there's a women's health therapist that you're working with, she or he is going to have a lot of experience. The training that we go through is extensive. So we have a lot of experience just coming straight out of school. If you're going to a physical therapist that does not, then, you know, possibly looking on the APTA website and finding one that is credentialed is very, very important, so that they do have the experience. You should feel really confident with your therapist. Your therapist should be very confident in what they're doing, and they should make you feel less awkward, just being in that environment and knowing that they're there to help you and they know what they're doing and they have the confidence to get you where you need to be.
Before we wrap things up, let's talk a little bit about what other things Dr. Sherri does outside of her practice.
So the clinic is a women's health clinic. It's actually a men's and women's health clinic now, because we treat a lot of men with pelvic floor dysfunction and also breast cancer. So the two areas that we treat is pelvic floor and breast cancer. With breast cancer comes lymphedema. We are occupational therapists and physical therapists are lymphedema certified, breast care certified. So our goal is to treat breast cancer patients and prevent them from getting lymphedema. So along with that, we have researched and designed a For the Girls compression top, and it's been 5 years researched and designed. We have a patent on it in the final design of the top. And what it does is it applies a mild uniform compression in the top of the torso and in the axillary region to support the lymph vessels and keep things from backing up. When you get a backup in the fluid is when you get the swelling in the arms, and then it's diagnosed as lymphedema. So if we can treat the area where the problem is rather than treat the symptom with a sleeve, then we're going to prevent a lot of people with a lot of unwanted swelling.
I'll put the link to that in my description, as well as the website that she gave earlier in the video. And what is the name of this place?
So my practice is called Dr. Women's Health and Physical Therapy and Occupational Therapy Services. We do a lot of great things for women and women here, and that's all we do is specializes in breast and pelvic. So this is our passion. This is why we're here. it's a great thing, and it's a great feeling to know we're helping a lot of people.
And I'll put the link to this place in the description, as well as Sherri's website for the compression tops. And we have other great doctors here, like Dr. McDowell. And so you don't just have to come to Sherri. Everyone here is great, and everyone works with you very well, and they're very sweet, and it's a great experience here. And I recommend seeing a pelvic floor physical therapist if you really do have severe pelvic pain and you need help with your pelvic floor dysfunction. So thank you all for watching. Bye, guys.
Bye.